Good afternoon, good afternoon, good afternoon. All righty. It is Friday. Thank God it's Friday. It's one day to the weekend, one day to the weekend. And this today is Friday, uh, February 26th, and this is another edition of the CareSouth Carolina Community Live podcast. I am Mark Calhoun, Director of Social and Community Services, one of your hosts, and my partner in crime, as always.
This is Daniel Myers, MAT Program Director for Care South Carolina, and I'm so glad it's Friday. I
Yes,
know
sir.
it's raining on the outside, but the sun is shining in my heart because it's going to be nice and pretty tomorrow. And I'm just anticipating the weekend for once. No rain.
No rain. No rain. All right. We have a special guest here today with us today. Very special guest. Been trying to get my man on here for a while now. Um, I met this guy several years ago working on the projects, and I have to say, um, I don't think I've ever met a more genuine and nice guy. Um, and now he's my neighbor, couldn't find out, right?
What?
We
What?
almost a block, maybe a couple blocks away. So
Wow.
um, I, I want to let him introduce himself and where his organization and tell us a little bit about himself. And because in this show right here, we don't like to speak before our guests. We let our guests speak for themselves. And
That's
so
right.
move forward. Go ahead, sir. Who are you?
Good afternoon, and thanks for having me. Don Strickland with I'm the executive director at PDRTA. Um, some of you may know, but we cover 6 counties in the PD region, providing public bus service and all those areas. Done a lot of growing here in the past couple of years. A lot of that's got to do with actually with CareSouth and some partnerships that we've put together, and it's been certainly a pleasure, and just looking forward to continued growth and here today to talk about some different projects we have going on, kind of where we're going for the future, and just what you might be able to expect.
All right. All right. Thank you, Don. Hopefully, like I said, with the weather, hope the weather hold up and we can get through the podcast. But Don, tell us about PDRTA. You mentioned the bus services. What are some of the services? Um, well, let's start here. How do you go about? How does an organization or a area go about getting bus service through PDRTA started in their area? Because I know there's some areas that our podcast touch and reach that may not have bus service just yet. So what are some of those areas ways that they can begin that conversation and get bus service in their area?
Okay, so yeah, you're right. And there's certainly quite a few places, especially in the rural areas, where we're not really providing a lot of bus service yet. We tend to start out in the more, I guess, even though they're in the rural areas, we call it urbanized, more like urbanized areas like main cities, city of Hartsville, city of Darlington, Bennettsville, Sherrall, Dillon, Florence, places like that. And really the model that we've been using for years now, we do receive federal funds, but in order to have access to the federal funds to put new bus service on the road, we have to have local stakeholders. And one thing that CareSouth's done great is in that area. So we've over the past couple of years, several years now, the only reason we're back in some of the areas that we're in is because of increasing the local stakeholders. We certainly believe that it doesn't matter whether an organization that's going to benefit from the service, bringing passengers to the front door, $500 sometimes just as good as $3,000. And we have stakeholders all over the place as far as local funding. But really, that's really how it happens. The hospitals, FQHCs, a lot of different, we work with Trinity Behavioral Health, a lot of different foundations kind of support what we do. But in order for us to bring service to an area that we're not already at, the biggest thing is for the people to be vocal about it and share that there's a need there. Be vocal to, their representatives, county councilors, city count, wherever they may be, and just let them know that the service is certainly needed. Our job is to be able to provide that service. We're commissioned to do 6 counties. We've been here since 1974, 75, doing just that. So those areas that we're not serving, the biggest thing is just communication, reaching out, letting us know what the need is, but also talk to your neighbors, talk to your family and your friends. If they all need it too, sometimes the squeaky wheel gets it, and that's really what they have to do. And we certainly, we're not against. If I had it my way, we would operate in every service area that we're commissioned to serve. And I hope that, sometime in the future we'll be at that point.
Absolutely. We're certainly getting close. Go ahead, Daniel.
Yes, sir.
Well, I don't know if we talked about this now, but what does PDRTA stand for? Because I want the people in the area to understand it don't mean people that need a ride to anywhere. So, but let's let them know what that means, because it don't mean that. It has a very special meaning, and it has those that means something. So can you, once again, it does not mean people that need a ride to anywhere. Okay, it's something totally different. So
Yeah.
would you mind just going over that for us?
Yes, sir. That's a very good point. PDRTA, it is Pee Dee Regional Transportation Authority.
Okay.
So we are commissioned to run public bus service. A lot of our service, you'll see bus stops on the side of the street. You can actually board at that bus stop. We'll pick you up, take you to many destinations throughout the communities. We have commuter services that connect different places. We're not a taxi service, so we don't really get into that. However, we do a lot of service what we consider to be demand response. So if you're a senior citizen out there, or if you have a disability that requires you to use a walker or a wheelchair, you can't get to those bus stops. Let's say that maybe they're half a mile from your home, and you can't navigate to get there. And that kind of situation, we our main number, and maybe Mr. Cowan can share that, but it's 843-665-2227, option 2. If they call that number, you can actually schedule a ride today for a pickup. It's the weekend now. Most of our demand response is on the weekday. So if you called us today and you had an appointment Monday and you kind of met that criteria and you're within a certain proximity of the route, we'll come to your house, pick you up. If you're in that 1A category and you're trying to get your vaccine at some of the CareSouth locations, we're actually scheduling people to get their vaccine. We'll pick them up from their homes and take them to those destinations. So we're certainly here to serve. We're not running folks to Charleston or Columbia or North Carolina. However, we do have service to Myrtle Beach from some areas, but most of those folks are they're going to Myrtle Beach to work. So they a lot in the hospitality field, but we're here, and our goal is to make sure folks have access, reliable, dependable public transportation to wherever they need to get to.
And give me that number again, Don.
It's 843-665-2227, option 2. That's our call center, and we have dispatchers there that actually they know everything that we do, so they're willing to have that conversation and just kind of share your need. And that's even a way, when I said you can voice that opinion, if we're not serving your area, they're constantly recording call, recording information, taking it down when you call in. So call that number and tell us that we're not serving your area, and let's see if we can't try to figure something out down the road.
Well, I know I was talking to you before we came on the podcast about there was some concerns with some of the people had, and I guess it's just a lack of understanding and not knowing where to find the information they need to get the answers that they want. So thank you for the number. But it was one gentleman that I was talking to that had an appointment with us. He lives in Dillon, and wanted to get here, and said that they wouldn't take me there. And you explained that there's a system, that there's a schedule, how all that works. Can you help us over in Dillon County? Could you explain how that bus route works and how you can commute between cities?
Absolutely. So over in Dillon County now, we started Dillon County service last September, October, and it's growing really well. But on Monday, Wednesdays, and Fridays, right now, you can go from Dillon, Little Rock, or Hamer all the way to Loudoun. They're serviced back into back and forth there. So, if you have an appointment Monday, Wednesday, or Friday at CareSouth in Atlanta, and you're in Dillon, but you need to go to Atlanta or in between, you have choices. So you're able to call that same number, schedule that trip, and we'll be there to pick you up. On Tuesdays and Thursdays, we have what we call demand response service pretty much all day. So if you're in Lakeview, if you're in the outskirts between, Atlanta and Dillon and all the surrounding areas, on those days, you can schedule your appointments, and we'll come pick you up and take you to the destinations, whether it's the, Dillon location or Atlanta location, anywhere in between there. A lot of folks use it to go buy groceries. One thing we try to, encourage people to do is when they're going to buy groceries on public transit, again, it's not a taxi service. There's larger carry-on bags where you can put 3 or 4 bags of groceries in one bag. Maybe limit it to about 2 of the larger bags, so you can probably get 5 or 6 bags. What we try to avoid is anybody having to make 5 or 6 trips on and off the bus to bring it off the grocery cart, because then we start getting behind schedule. So
yeah,
to be mindful that if they are doing that, just kind of try to bring on what you can carry, and that's really the biggest thing. Another important part that I want to talk about is Mohawk. I mean, not Mohawk. Well, Mohawk too, and Marlboro County. We'll talk about that. But Harbor Freight, we're running bus services now. We started just a few weeks ago to Harbor Freight. So if you're an employee there, we're focusing on first shift and then bringing second shift in right now. But anyone that's in those areas of Latta, Little Rock, Lakeview, Hamer, all of those areas, or in Dillon, we'll get you to work. So that same number I mentioned, they call that. We've already got folks using that service to get to Harbor Freight. If one of your issues was reliable rides in the past and you kind of avoided going to apply there, now maybe the time. It seems that they're constantly hiring and they're doing good things with starting pay and everything else. So we're there to get those employees to work so they can go back and feed their families and take care of them.
Yeah, I think you just made a bunch of people upset when you said that, because now I can't use the excuse I ain't got no ride to work. So you just messed that up for a bunch of people.
Yeah, so we've heard the story many times about 4 or 5 people riding together, and the main driver, they end up having a flat tire, transmission, some other issues, and then no one goes to work. So we're there to Okay, carpooling is great, and this is not to discourage that, but in those cases where maybe you don't like that other person a whole lot, maybe they're giving you a hard time, or if the vehicle breaks down, we're here for those people, and we can talk about the vehicles themselves, but we have audio, video cameras on board our buses. Our drivers are certified first aid, CPR. They go through a ton of training. How to de-escalate a situation that they go through a ton of training and a lot of refresher training, similar to I know a lot of the CareSouth community and employees as well. So the camera system, we have bike racks on every bus that we operate. So let's say that you're out off the beaten path a little bit, you can hop on your bike, come to the closest route. Every bus on the front of it holds 2 bikes, so you can actually bike in, throw it on there, take the bus the rest of the way, and then get to wherever your destination is. All of the services are fare free that we're talking about. So
see, Marek, I think that's the key right there. See, because I can tell my wife I'm going bike riding, right? Meet PDRTA, ride to Dillon, go to Starbucks, get me a caramel macchiato, extra caramel, and then come back sweaty on the bike, and she'll never know, that I didn't. You know what I'm saying?
Yeah.
Thank y'all for that. That's okay.
Hey, or she'll be really impressed. You tell her you rode all the way.
That's right. Hey, that's what I'm talking about.
So you could ride to Dillon, and I can meet you in Dillon. You could ride down the street, put the bike on the rack, meet you in Dillon. We can go fishing, and then we can bring you back to the stop. Let you ride back home.
That's it. See, we got a plan. Thank you very much for that. That's the setup. That's the setup.
Hey, we got to limit the fishing rods to 2 per person too on the bus. So they may be afraid of the crickets and the worms. I don't know. We'll see.
Absolutely. Nice. So you took us through the training that your staff has. All right. So let's talk about the age of COVID and some of the precautions that you all put in place, because y'all been ahead. Y'all been on this for from the beginning of COVID. Um, and y'all put some provisions in place early on to make sure the passengers are safe. Because safety, we've had this conversation quite a bit. The safety of the passengers is paramount, and is your main focus. So can you talk about that a little bit?
Absolutely, that's a great point. So we focused we hit it early on at PDRTA. We were paying attention to what was going on in some of the bigger cities. New York, for example, was one of the biggest ones we saw before it really hit us hard. We had about a 2-week warning before we really knew what was kind of going on. So one of the first things we did before pretty much I think most other providers were we went ahead and put barriers in place, plexiglass shields for all of our drivers. We quit taking fares in areas that we were actually taking fares, because that was just another process where they were going to be close to the drivers and then handling cash. At that point, we didn't know whether you could catch it from handling cash or anything else.
Right.
But there's a lot of different things. we have a product that we have a team that actually disinfects. It's actually a fog. It's a medical grade product.
Okay.
That you really spray it on the surface that will kill the COVID virus, and 5 minutes later you could eat off that same surface and it won't hurt you. So that I thought that was important for us to implement that product. Hospitals use it pretty much in a lot of different surfaces that they do. We hit all the high touch areas, the seats, the grab bars. Face masks are required on an entire transit system. The one of the expenses that we faced was if they didn't have a mask, we actually provided it. So every one of our services, buses that we operate, the drivers have additional mask and everything for those that for some reason they step out, they're in the yard, they just forget it. Our driver will actually give them one to wear, and we're going to probably continue that for a while. It's important, and we don't want folks not to be able to get to where they need to get to because they left their mask a half a mile away or whatever. So try to look out for them. We still encouraging social distancing on the bus. So unless you're in the same household, like a husband and wife, obviously they can sit together. But if you're from different households or not together, we try to limit, one per 2-seat section in the bus, just to try to give people some room to spread out. We've actually added vehicles to kind of combat that a little bit on our heavier ridership routes. But we've done a lot of things, and we have to continue doing those things. One of the biggest things that I've been thankful for is just the partnerships with CareSouth and some other entities to be able to get folks to testing. So when y'all were offering rapid testing and everything else, we were taking clients and passengers to your locations all the time, for them to get tested and really know if that those cold-like symptoms are something they need to really worry about. And then we're partnering with the vaccines for those that are eligible for the classes that are out there. So we've been taking those, and I'm sure that's going to be something that's going to continue and even ramp up where we do more of those in the near future.
Absolutely. So you had started started talking about Marlboro County and the bus service there. Could you expand on the service there in Marlboro County, because it is kind of unique?
Yeah, Marlboro County, we started just over 2.5 years ago now, and it really took off. We're still transporting over 3,000 people a month there. We have for Marlboro County and the size of the county, I would call it pretty good service. We have a city route in the city of Bennettsville, similar to what we have in Dillon and Hartsville, and it runs throughout the day. Then we have connecting service between McCall, Clio, and Blenheim to Bennettsville, and they all connect to Carl's IGA right there. I think that's on number 9. And along with that, we have demand response service. So I shared earlier about the folks that may be in a chair or they can't get to a route. We schedule those trips, and those numbers are actually climbing. And then we're taking quite a few people to work at Mohawk. We have services from Bennettsville, McCall, Clio, and Blenheim to Mohawk. We're taking about 20 people to work every morning. And then every evening they have 12-hour shifts, 8 a.m., 8 p.m. And anyone that's there now that works at Mohawk and they need a ride, hey, that same number, I'm going to end up having to bring some more people to answer those phones. But that same number that we mentioned, they call and schedule their rides. That's 7 days a week. If they're open 364 days a year, that's how many days we're running that bus service. So we're there for the people, and the service is doing well over there. The county's behind the service, and I'm hopeful that we'll be able to, pretty confident we can sustain that. From there, we now have connecting service between Marlboro County and Chesterfield County, and I guess we'll transition over to Sherrall. So we're going through Wallace. Where folks in Wallace have connections now both ways. They can get to Sherrall or to Bennettsville, and it's a good partnership with CareSouth there, McLeod Hospital, Northeastern Tech, the city of Sherrall, the city of Bennettsville is on board. Like I said, the Care First Foundation is a big partner in that. The Love Foundation obviously is a big player in all the services that we have in those areas. But things are starting to look well. We have fixed route service in the city of Sherrall. It's called the Sherrall Express. We call that the CCAT. That's Chesterfield County Area Transportation. Over in Marlboro County is the MARTY service. We're kind of getting creative. I didn't say it earlier, but the Dillon service is the DCAT, Dillon County Area Transportation. So they're all doing really well. Ridership's growing. The Sherrall service just started in January, and I see the numbers climbing. We're going to focus in on industry piece. There's a lot of folks trying to get to and from work. Then we're going to hopefully, ideally, we're already getting a lot of phone calls from these areas, but we've got to be able to connect the Sherrall area to Chesterfield and Pageland and Jefferson. The new location over in Chesterfield from CareSouth. My hope is that we're running by that front door and getting patients to and from there. And a lot of folks work in the Pageland area. There's a lot of industry there, so having connectivity eventually between all of these counties, the 6 counties we're commissioned to serve. It would be nice for someday that someone in Chesterfield County, if they want to get to Florence, they can do that. If they want to get to Dillon, they'll be able to do that. Right. So that is the long-term goals. Like I said, it's going to take additional stakeholders and partners buying into the whole program. If I sit here and started naming them, we'll be talking for another 10 minutes. We have a lot of local stakeholders, and really it's people that understand the importance and the need, that people really need the service. Not everybody has, several sets of car keys in their household. A lot of times you have one car, the husband or wife, whoever, may be going to work, and then you have the rest of the family there that doesn't really have a way to get around. So public transportation will be the way for them to go about and be able to also do some things on their own.
So we did have one question out of the Marlboro County area. Y'all do go by Sopaco, right? Is there a stop in that area?
There is, and I'm hoping that we can partner with Sopaco. I know that I think there's more than one location, but that's an area we actually will provide the same service that we're doing for Mohawk. If those employees, if there's the need there, they call us that same phone number, and we can schedule their rides as well.
All right. Thank you. All right. We got Chesterfield. We did Dillon. We did Marlboro. What about Darling County? What we got going on over there?
The Hartsville Transit. It's called the Free Hartsville Transit. Believe it or not, during the COVID season was the route that was the least impacted. Our ridership remained pretty strong on that route. So while some services were reduced by 35, 40% at times, Free Hartsville Transit, we were seeing only 10 to 20% reduction. So the numbers kind of stayed up there. A lot of folks that were dependent, I think, were people that were working. And I think that made a difference. Then we do have a lot of senior citizens in Hartsville that use the service. Obviously, CareSouth, Carolina Pines, City of Hartsville, Coker, Barley. We're trying to. We've got to find a way to increase some of our local funding and stakeholders in that area, especially in Hartsville. I understand that the city officials they have a desire to add additional services. and I'm hopeful that this coming year we'll be able to figure that piece out. We have the Darlington, the DART route, and it's actually still doing very well, and it runs around the city of Darlington, similar to all the other services. And then we have a Darlington to Florence commuter bus. So is someone going from Darlington trying to get to Florence Arlington Tech, or on to Florence going to excuse me, hospitals or MUSC, anywhere like that, they have access. I do think that there's a big need for us to just from the call volume we get from this, but having connections between Hartsville, Darlington, and Florence. So at one point we did have that service, and we had people taking advantage of it to get to work. Believe it or not, we had more people that was working coming from the Florence Darlington way to Hartsville than we did the other way, and I think that had something to do with employees coming to work. So, but I'm hopeful that we'll be able to figure that out again, maybe this coming year, and grow the Darlington County services even more. We do provide some service over in Lamar, and connections between Lamar and Darlington. So there's certainly room to grow, especially in those rural areas that we've been talking about. But the main thing is making certain we can sustain, and then trying to bring on additional partners to bring service to those that need it.
Wow, that's a lot.
That's a lot. That's a lot. But you know, Marek, I like the idea of removing barriers so that people can go along with their, go on with their daily lives and get to work, get to the grocery store. I know in Dillon County, this is a big thing over here, because there was people that was, you paying when you don't have resources, you pay what you have to pay to get what you need, and sometimes taking advantage of the elderly by overcharging them to go and pick up their prescription from Walmart. $40, $50 to pick up prescription, and you're already going that way. That's just not fair. So having this service available to just them, it's already paying dividends back into our community, because it's giving them their income back, opening other avenues for them to go and eat and go and, go to doctor's appointments where they, without spending all this extra money that they don't have to begin with. So I know it's a guy.
You made a great point, man. I remember one of the first public hearings that we had in Dillon before we started the service, and there was a lady that came to the meeting, and she was in her mid-70s, and she rode with someone else. But she was telling me that her own kids and grandkids charged her $20 each way for her to go get her essential services done. And so she was excited about the service and the fact that we were able to have enough local partners to make it fare free. I mean, it changed her whole world. So that money that she was spending trying to pay them to get her somewhere, she's buying groceries and paying bills with it. So and I'm sure medication that she has to have.
Yeah, it's increasing her quality of life. This is really helping a lot of people. I work with the of course MAT department, and some of our patients need transportation back and forth from counseling to their appointment. So this removes that barrier, so it lessens anxiety, lessens stress, and help with their sobriety, because they don't have to worry about this aspect now. I can get to where I need to get to and not be penalized for missing my appointment or being late. I have access to both places I need to go to, and that's wonderful.
Yes, absolutely. I have to agree too. With my folks, we kind of deal with what I'm gonna get public health on you a little bit. Those who work in public health know that social determinants of health, and transportation is on that list as a social determinant of health. Social determinants of health are those things that operate outside of the doctor's office, outside of the what I like to say the exam room, that may ultimately affect your health. And transportation is definitely one of those social determinants of health. I mean, if you can't get to your appointments, or you can't get there on time, or can't get to the pharmacy to get your medication, can't get to the grocery store to get the substance you need to help with your comorbidity, then that can create a adverse effect on your health. And so Don and his crew over there at PDRTA are helping to close that gap and to tear down that barrier of social determinant health to make individuals are healthy. I mean, we talk a lot about the Robert Wood Johnson County Health Rankings and where the counties that we serve and all of those counties that we just talked about, where they sit on that ranking. But Don and his guys, you're making a difference in the health of the people in our community, because your service is allowing them to get to the hospital and to get to the doctor, get to the pharmacy and all those things. And I want to take the opportunity now to say thank you. I mean, when we set on that journey years ago, I can't believe it's been this long. And I remember that first conversation, and Joe introduced me to you and your counterpart at the time, and I remember saying in my mind, we did this before in Hartsville. It didn't work. We did, that doubt set in my mind, and and then it was like, and I got to commend Joe. Joe always in the mind of, don't worry, we're not gonna talk about the past, right? We're gonna talk about the future, and look where we at by getting rid of those past negative thoughts. Yep.
Yeah, and then another thing, and just more kudos for you guys, and you give everybody a pat on the back, with your corporation, is that you're helping save lives. You're bringing people in for the vaccine. You guys are instrumental in getting us back to a normal way of life where we can. I always like to say this: take off these masks and stop looking like little mad bulldogs. So everybody can, so I can see people smile, so I can see your faces, and and see and recognize people when they speak to them, and be like, baby, who was that? Because everybody look alike with these masks on. So, you're helping us get people to a place where they can get their vaccines. And after a while, we're going to be able to just walk around with these things off, and you'll be able to see some of the people that's riding on your bus. You'll be able to see their whole face. So, I mean, that's wonderful. I can't wait to see people's whole face. Some of them.
Exactly right. The reason we're here, and the reason that, we're having this conversation today, is because we're willing to have collaboration. Like, you got to be able to work together, and that's the one thing I'll say that it's made the biggest difference. And believing in each other, and knowing that if we can share the same vision, and that at the end of the day, we're here to help people, and that's really what it's all about. And if you have that, and you have that servant's heart, then I believe that we're gonna make this thing happen. And this is just the beginning of where we're headed, and I truly believe that.
Wonderful.
Absolutely.
Yeah.
Wow. This is definitely, and while I'm thinking about it, can we talk about the app?
Oh yeah, absolutely.
Let's talk about the app. I'm excited about the app.
It's we've actually found that a lot of our passengers have downloaded it, and they use it on a daily basis. But it is called the PDRTA Sync app. And maybe the next time you have me on, I'll share a flyer with you and show people how to download it. But if you go to your app store on an Android or Apple device, and you just type in PDRTA, and actually just put that in, you'll see the PDRTA Sync app, and they're showing it to you. There it is. And you download that. It's free. You will actually be able to track every vehicle that we have in service in all these counties that we've been talking about today. And now don't do this while you're driving down the road. But if you were in the passenger seat and you had your app up, and you were looking at let's say the Hartsville bus, when that bus goes to make a left on 4th Street, in that app you would almost see it in exact real time making that left. So it is it's been a game changer for us. You imagine a senior citizen in the middle of June sitting at a bus stop for 20 minutes waiting on the bus to get there. Now, if they got their smartphone, and a lot of them do, they'll be able to take a look at that app, and they can sit in air conditioning until that bus gets a little bit closer to them, so they're not out there soaking wet, or the rain, or any kind of elements.
Mm-hmm.
When they're shopping, they can pull it up and say, "Hey, where's the bus at?" And once they get accustomed to it, they know about how much time they need to get back out there to that bus stop. So it's been a real good thing. We're actually going to be pushing some updates pretty soon that's going to make it even better. Right now, it's not the prettiest thing to look at, although all the information's there. But we're going to work on tying that to our new website, and it'll be more user friendly in the near future.
Absolutely. Thank
There
you.
you
Thank you. All right, that's it. Thank you. Thank you.
Thank
Well,
y'all.
definitely, we appreciate you coming on, Don. This was some great information. Been when wanted to get you here for a while because I know you had some great information. And you definitely didn't disappoint. You gave us some great information on the different areas of where PDRTA operate, and we appreciate the information. We appreciate the effort, the Herculean effort that you all are doing to one, make sure that the passengers are safe during their rides. Two, to make sure that they're getting to locations that they need, and addressing their issues of health and wellness. And I mean, just being y'all, like we said, you just making a difference in the community, and we definitely appreciate it. Again, you were one of our great partners. Last year we were able to, you all were our community, one of our community partners of the year, and again, we thank you for the service that you bring into the Pee Dee region. Thank you.
Hey man, all those feelings are mutual. I appreciate you guys. We together is a lot easier than trying to do it alone. That's for sure.
Absolutely. Before we close out, one of the most important questions that we always like to ask our guests, and when they're on here, but we always like to think, when Don is not PDRTA, and Don is not doing everything PDRTA, what does Don like to do?
Yeah, Don. What is it, Don?
Yeah, how do
Well,
you
for,
unwind?
for the for the past couple years, it's been trying to renovate this old 1935 house I live in. But I enjoy family time. Church, God obviously is big in my life, man, and fishing, and occasionally playing golf, but fishing before golf always.
Hmm.
Yes.
Oh,
Let me
uh-oh.
know when you're ready.
Uh-oh. I think you just started something, Daniel.
I know, because I everything that you name is me too. Because my house was built in 1939. I love
Really?
fishing. I play golf, sporadically.
Hmm.
Um, but if I had to choose between the two, and I ride motorcycles too. But if I had to choose, it's gonna always be fishing.
Yes.
I hear
Well,
you.
because I'm a preacher too, so that gets me close to the water. And they, say cash your bread or put in the water in the return. And so I wait for a word to come while I'm fishing.
I
So if I
hear
don't
you,
catch
man.
a fish, I can at least catch a word.
That's
All
right. I
right.
learned I learn a lot in those quiet times, especially when the
And
fish ain't biting.
that's right. That's right.
Yeah.
That's
Yeah,
a lot.
hey, our last trip, we learned that one, didn't we, Daniel?
Yes. Yeah.
Like almost
No,
like 3 days of nothing.
We don't
yeah.
talk about those days, man.
No. No. What I wanted, because I kind of fish about that big, in my mind, but it never
Yeah,
hit my line though. So I saw them out there, but they just wasn't biting.
yeah.
Yeah, I think the
How it
closest
is sometimes.
the closest thing we got to catching some fish that weekend was a gentleman who gave us some that
Hey,
he had already.
that works too.
Yes.
But yeah, absolutely, absolutely. We definitely get an opportunity. We need to make that happen. Maybe we put together a guys fishing trip, between us and a couple of other guys we know in the organization. But
Yeah.
we thank you for coming on today. This was some great information, and hopefully we can have you back again, because I'm sure you're going to continue the work that you're doing, and to you know continue to update us on some of the new developments and changing, because y'all are a really aggressive organization and progressive organization, and come back and share some of those updates and new happenings with us in a later date.
And Marek, let them know that if something happens with PDRTA, you guys really need to get some information out really quick. You can always contact me and Marek, and we can get you on here and we can
Yep.
get it out again.
Yeah,
Really,
I've heard about the number of followers you guys have. That's where
yeah.
I send all my flyers to.
Come on.
Yeah. Anytime you let us know. Anytime, you're welcome. You're a friend of the
Appreciate it,
show.
gentlemen.
Come on back.
Thank y'all.
All
Yes.
right, y'all. Again, Pete. Again, this is Mr. Don Strickland, PDRTA. You want to reach again that PDRTA demand service is 665-2227 option 2. And you want to hear more about Care South Carolina, or also let me go back. PDRTA. You can go to their website. Could you give your website?
Yes, at www.pdrta.org.
All right. If you want to hear more about that, you follow him on that website. You can also reach out to us. You can find us on our webpage at www.caresouth-carolina.com, www.caresouth-carolina.com on a new revamped website. Also, you can follow us on Facebook as well. All right. So we thank you. This is the end of this week's edition of the Care South Carolina Community Live Podcast. So we'll see you again next week. And y'all have a great, safe weekend and enjoy.